All right, hi, Paul Sakis, Good News Broadcast, Good News Planet, and Pause the World for Peace. You know, this is a conversation we're going to have about pausing the world because we're going to talk about actually a rare and debilitating disorder called Rett syndrome. That's R-E-T-T, and we're very fortunate to have Dr. Stephen Skinner with us. Good morning, Doctor. How are you?
Good morning. I'm doing well. Thank you.
And a very brave woman, Cassie. Hi, Cassie. How are you doing today?
Doing well, thank you.
So, Cassie, you have twin daughters, both live with the Rett syndrome. So, this is first 6 months to 18 months of their life without warning. So, let's first discuss what is Rett syndrome, and then let's go from there because I'm sure you've had a hard scenario to live with, and thank you for coming out to do that. So, Dr. Skinner, what is Rett syndrome?
So Rett syndrome is a rare genetic developmental disorder that affects predominantly females, though rarely affects males. The hallmark of it is, as you kind of alluded to, there's a period of normal development that can last the first 6 months of life, sometimes up to the first 3 years of life. Then there's a period where the development of the child slows down and then actually regresses. So regression means that there's loss of skills. So these girls typically lose speech or verbal communication. They lose some hand use and other motor skills. Fortunately, the regression stabilizes after several months, but they typically do not regain those verbal and motor skills to the level they had before. So it's a lifelong condition that affects verbal communications, motor skills, hand use. There's a lot of other medical symptoms that can present at other times in life, from seizures to breathing issues to gastrointestinal issues, scoliosis, as well as some of the things that Cassie will probably describe with hand wringing and teeth grinding and other things that we see in these individuals. It's a lifelong.
Go ahead. I'm sorry.
No, that's all right. I was just going to say it's a lifelong condition that impacts not just the patient, but the family. That's their caregiver, as Cassie will describe, 24/7.
Sure, by far. Let me ask you, just, I guess, a medical question, one more. I'm a TV producer. I was working on PBS Channel 13 here, and we did the Brain series back in 1982. What type? I mean, is this a brain dysfunction? How does this occur? Or do we know, or do we not know?
Yeah, so there's a particular gene that's associated with this condition. It's called MECP2 or MECP2, which is important in brain development, brain connections between brain cells. And when MECP2 is not functioning normally, which is what happens in this condition, it causes the brain to not develop and make these communications connections that are necessary for normal development.
Okay, so but we're going to have some good news here in this conversation, because I see something called Day Blue. So let's go to Cassie. And Cassie, thank you for coming out and speaking about this. So your experience is?
So my girls are identical twins. They're 10 years old now, but at around their first birthday, I started noticing some differences in the girls. We had normal development for about the first 6 to 9 months, but at around a year, I noticed that Kenzie was not starting to crawl, and I was watching Kaylee start to meet that milestone. She was starting to stand, to pull up and start walking, and Kenzie was just sitting. And so I started having some concerns then. I felt like Kenzie was kind of almost going backwards and regressing in some of her skills. At the time, the pediatrician wasn't that concerned. She just assumed she would catch up. They're identical twins. They have the same DNA. So we started some therapy, but at about 15 months, I started noticing some more alarming symptoms. Kenzie started hand wringing. And so her hands were constantly at midline right in front of her mouth and just wringing her hands. She was teeth grinding just constantly and just inconsolable and crying all the time. And so I started doing some research on my own and came across Rett syndrome. And so I set up an appointment to have her tested for Rett syndrome at a geneticist, and she did test for Rett syndrome, and the results were positive for that. So this triggered a testing for Kaylee as well, which at the time, Kaylee was not showing any signs of regression. But since they're identical twins, we had to test, and sure enough, Kaylee has the exact same genetic markers for Rett syndrome. About 6 months later, we saw Kaylee's regression at the age of 3. So Kaylee started losing her ability to talk, her ability to purposefully use her hands, and she started the same thing as Kenzie with the hand wringing, the teeth grinding, and just inconsolable crying. And so that started us out on our journey with Rett syndrome.
Wow. Well, you know, you're and how old are they now?
The girls are 10 years old now.
10 years old. And how do they function? Are they fully functioning or not fully functioning?
So they're very different in how they present with Rett syndrome. Kenzie regressed first. She never learned to stand on her own or walk, and so Kenzie is wheelchair bound. Kaylee still maintained her ability to walk, fortunately. Both girls are nonverbal. Kenzie struggles with seizures and a lot of respiratory illness, which leads to a lot of hospitalizations for her. But they are 24/7 care. So they require, diapering, feeding, medications. I sleep with them at night to give them care at night. I homeschool them and organize their therapy schedule for the week. And so it's 24/7 and it's lifelong. So.
Well, they're a gift from God. I'm going to have to say this here, and you're a gift from God, and you're a family all around you. Dr. Skinner, tell us more about this. I mean, debilitating disease. Well, tell us the good news, because I like to get to the good news, guys, because I'm seeing something for the first time ever. All right, I'm good news.
That's right.
What's the good news here?
Well, the good news is that for the first time ever, we do have a medication that has been approved by the FDA specifically to treat symptoms of Rett syndrome. That medication is Daybue, D-A-Y-B-U-E. And it went through the clinical trial process and was shown to significantly improve certain core features of Rett syndrome, particularly some of the things that Cassie talked about: attention, focus, stamina, the ability to maybe not verbally communicate, but make more vocalizations and maybe respond better to parents, family members, and therapists. So it stabilizes some of the symptoms. Again, it's not a cure for Rett syndrome. It doesn't work the same in every individual. There are some side effects, but they're manageable. So it's the first hope that we have to actually treat core symptoms of Rett syndrome, and points to a greater hope for the future that hopefully there'll be new treatments coming as well.
Let me go backwards a little here then. No, that's great. That's marvelous, Daybue, and they have a beautiful website. And they have some organization here. I saw that also Acadia Connect. They have an organization that support on your side. So I don't know, Casey, do you use that support by your side organization? Do you know about them?
Yes. So Acadia has been there with us and walked us through a lot of this process. There's a lot of great support for Rett families through social media, through foundations, and things like that. So we have found a lot of support through our Rett community.
Okay. Then, Doctor, let me ask you my first question. Sorry, I got sidetracked myself. How about prior? I mean, are there research studies going on now to see why that happens to the brain? Have we gotten any closer to don't eat cinnamon? I don't know. Is there anything in that can go to your brain and affect it? Have we come up with any great discoveries?
So it's fascinating. The gene associated with Rett syndrome was first identified in 1999. So it's not been known that long in history, but there's been a lot of research to understand why, when that gene's not functioning well, it causes Rett syndrome. And there's a lot of exciting research looking at additional potential therapies, including gene therapy and potential reactivation of the X chromosome and things like that. So I think there's a lot of exciting research to try to understand why it causes Rett syndrome and how we might be able to treat it more effectively in the future. Those studies development debut.
And doctors in today's medical world that go to medical school since '99 is like yesterday. Is this one of the studies that they'll talk about so somebody can see these signs early on?
That's certainly one of the goals of interviews like this, is to make sure that physicians are aware of the signs and symptoms of Rett syndrome so that they can recognize it earlier, get appropriate diagnostic testing done early so that they can get started on treatment earlier as well.
Okay. All right, Cassie, do you want to have any thought that you'd like to share with the audience?
Yes, so the FDA approval at debut has been really wonderful for us. It's given us a lot of hope. We've seen a lot of good progress from using the medication. We're seeing more vocalizations. We're seeing more purposeful hand use, calmer hands. We're seeing more energy, stamina, and just overall just having more good days than bad days. And so we are very excited and grateful for the FDA approval of this treatment.
Anything else, doctor, that we should know about?
I think the main thing is for physicians to be aware there is treatment available now, and go to that website, get comfortable using the medication. And as Cassie said, these parents and families need a lot of support beyond just medication. So hopefully we can continue to provide that support for their day-to-day challenges.
There you go. And Cassie, and continue being a loving, caring, kind, giving mother and family. That is, as I mentioned, a blessing. Thank you both very much. Appreciate it.
Thank you.
Thank you.